Okay, so it's now my pleasure to introduce our keynote speaker. His name is Darrell Mitchell, and he is chair of the National Association of Recovery Residences. I guess his slide has already been up here for a few minutes. Darrell is the founder of the Indiana Affiliation of Recovery Residences and serves as the president of the National Alliance for Recovery Residences. He serves on local, state, and national recovery and mental health boards and committees, and speaks frequently at regional and national conferences and events. He also serves as vice president of recovery communities with Aspire Indiana Health, overseeing the integration of recovery principles and practices across Aspire's healthcare system, including substance use disorder resident and recovery facilities, medical, outpatient behavioral health, housing, and employment services. He amplifies the voice of lived experience of the population served by Aspire and within local, state, and national communities, while also serving as the executive director of Progress House. Darrell has been given numerous awards and honors for his work in recovery housing, including the Heroes for Recovery Consumer Advocate Award from Mental Health America of Indiana in 2016, and a prestigious leadership award by Indiana Housing and Community Development in 2018. It turns out that Darrell did not anticipate a career in healthcare, behavioral health, or addiction treatment. He'll tell you that with the help of others, he overcame his own addiction and has been in long-term recovery for many years. Experiencing the miracle of recovery in his own life inspired him to pursue a professional path of service to those with mental illness and substance use disorders. Darrell studied public relations and marketing at Purdue University, has a bachelor's of science in addictions counseling and a master's of business administration degree from Indiana Wesleyan University. So please join me in welcoming Darrell to the podium.
Good morning. Man, we are among a distinguished history here. I've seen this room on television. Pretty amazing. Thank you. First for being here. The thing that's always interesting to me when I listen to somebody talk about, what I've been doing and what I am doing, I always have this overwhelming sense of gratitude. I know that seconds and inches in my life separated me from death, probably prison. And I've also been taught by other people in recovery that gratitude is action. And that's what makes me always eager to say, how can I help? And I'm happy to do that, whatever that looks like. So when I'm in a room full of people that come together, I know that there are challenges in every community that has recovery housing. This is a complex population that is served through recovery housing, but I'm always encouraged when I have an opportunity to travel around and see people come together, in an attempt to communicate, get educated, and to better serve your communities. So in that spirit, I want to encourage everybody to keep an open mind here today. One of the other things that I've learned is it's important for me to kind of set aside the things that I think that I know, and be willing to hear where people are currently in a situation or circumstance to be able to be useful. So let's just talk a little bit about some of the national perspective around recovery housing, and I want to let you know what NAR does and kind of set the stage for the conversations that we're going to have today. So the important thing to think about is this is housing, right? It's not a care facility. This is where people live, no different than your neighbors or you in your communities. Okay? It's a special class of protected people. These are folks that have substance use disorder. This is an absence-based model, recovery housing, with the inclusion of medication-assisted treatment and what we would call peer recovery support. That's the magic sauce of recovery housing is the social model. And it operates like a family-like community. So I'm not trying to, I don't want to say dumb down, that the word provokes, I don't like that word, but what I want to do is make sure we understand what it is that we're talking about here, because oftentimes people confuse treatment and recovery. The thing that I would say about treatment, so my day job, I have 300 beds in Indiana, and there's treatment beds, recovery housing beds at different levels. And embedded in all those facilities, I have healthcare practitioners, mental health practitioners, peer support. All my operations guys are guys that have lived in the recovery houses. So people come into recovery housing thinking that they're terminally unique. And we can say, no, you're not terminally unique. Everybody here has been where you are. But the important thing, I think, to remember is that if treatment, and I'm a clinician, I mean, what it didn't say, I'm wrapping up my master's in addictions counseling, right? So I do a lot of counseling. If treatment was all that was needed to deal with the epidemic that we face, and before COVID, this was the #1 public health and public safety epidemic, right? If treatment was all that was needed, we wouldn't have an epidemic. We would send everybody to treatment and we'd be okay, right? And if we only needed to send people to, to jails and institutions, again, we wouldn't have an epidemic. Treatment is so necessary for people to get stabilized in hopes that they get into recovery and have an opportunity to change their lives. There's 4 levels of recovery housing, and just to familiarize quickly, is in all 4 levels that NAR certifies recovery houses, and we do that through state organizations such as NHCORE. These are all alcohol and drug-free environments, so this is abstinence space. And the words, so you're gonna hear me say recovery residences. Yeah, I was with some people yesterday and somebody said halfway houses. And I always think halfway to where, right? Or sober houses. I'm like, my dog has been sober a very long time. My dog lives in a sober house. The point about recovery housing is recovery implies that there's something happening in that residence that's unique, right? And we can talk about the different definitions of recovery, but that's an important component. So it's not just the drug and alcohol-free environment, but this is a social model. And if somebody said to me, hey, what's the most important thing in your recovery today, Darrell? I'd say connection. Connection to, for me, a higher power, and connection to the other people that are in my community that support my lifestyle. That allows me to bring connection to you in a way that I'm not harmful to anybody any longer. You know, I stand before you today, an alcoholic and an addict, but I haven't had a drink or a drug in a very long time, right? So this social model is critical. As we move, and so none of these levels of care are more important than the other, but as you move through these 4 levels, there's recovery support services. So, and it's not prescriptive. It can be faith-based. It can be 12-step models, a variety of different things. And then at the highest level, the level 4s, there's clinical services. That can be actually embedded in the house. It could be a relationship with a mental health counselor that comes in to do work. It could be case management people that come in to do clinical work. So it depends on the need that somebody has where they may enter this continuum. The intersection of housing and recovery is such an important component, right? This is what differentiates the treatment component. So we know that the #1 indicator of addiction, ironically, is zip code. That's often because of the social drivers of health. If people don't have housing, they don't have food, they don't have employment, there's a likelihood that they're going to treat the challenges in their life with substances. This slide, I think is important to have some context around. If you look at the upper left-hand corner where it says hi, this is where I see some EMT folks here. God bless you for the work that you do. You save lives all the time. But this is where this acute episode happens. Somebody may overdose. There's Narcan administered. Somebody, on my way here today, I'm riding with my friend Anthony. I got a call, got a buddy in Indiana that's looking to, he's alcohol withdrawal. I'm like, dude, you got to get to a hospital. That could be fatal, right? But that's episodic up there in that left-hand corner. If we don't get services to that individual, then what we're going to see, and what VMT folks would probably tell us, is that you see the same people all the time, right? And or the ER is being used as the primary physician. And in Indianapolis, where I live, 90% of that county jail, the inmates have been there before. 80% of them, 70% of them, thrive fair, are there for drug and alcohol related offenses. So there has to be something other than that upper left-hand corner. So this curve is somebody's journey through recovery, And as the intensity kind of moves, and as people are moving there, you know, and what we're wanting to get to is that far right-hand corner where long-term recovery, you know, so you have independent, meaningful living, there are services along the way. And you see where it says recovery housing and different support levels, those 4 things I was talking about, that's where that occurs. But there are services along the way, and recovery is not a, you know, the same size fits all. There's different services that are needed. So these different levels are important. So NAR, the National Alliance for Recovery Residences. You know, just quickly, because I know I only have a limited amount of time. These are the founding purposes that there's a National Alliance for Recovery Residences. It's important that we can expand recovery housing. When I started in Indiana, we have 92 counties, 36 counties did not have any housing. If I do the math on, you know, 10% of the population actually have the disease of addiction. Some of them set fire to it in a bar, at a meth house, different places. But if you begin to look at that and you say, what if you take the population of New Hampshire, and here's the population and 10% of that, well, what if 10% of that number needed recovery housing? You would get some sense of the type of capacity that's necessary in order for people not to just keep going through the ER or keep moving through county jails or through DOC, right? So we also wanted to have best practices, ways that we could ensure that a consumer going to a recovery house that was operating under these national standards was living in a safe and sober environment, right? So this is a way for consumers to know that they're going to be protected. And we also wanted to create and support state-level provider-focused organizations, NHCOR. They could come and do the work with those houses that are here, and then the houses in turn could do the work with the residents, the people that live in your communities that desperately need these, and assist in developing policies to expand recovery funding opportunities. Now, oftentimes, and you know, I've had the pleasure of spending time with operators here, you find that the people that are operating homes have been touched by addiction in some way, sometimes in tragic ways. Sometimes there's success stories, and you have a son that's successfully now in recovery, and you open these homes. But these are people that have a heart for the people they serve. We were founded in 2011 by a group of people that are considered to be subject matter experts. And we took decades of experience of operating homes and began to write these standards. We have a national standard code of ethics, which is critically important. And it also covers the full spectrum of recovery housing, as we showed those 4 levels. We currently have relationships in 30 states. So NHCORs, we have 30 in it, you know, 30, we don't have 30 KIMs, but we have 29 aspiring people to be KIMs. And then we have 6 other interested organizations and 3 that are in talks. So the work that we do, you know, so this morning someone said, how many employees you have? We have 4. We used to have none. We used to be a board of operators that had day jobs, and then we'd spend the evenings writing these standards, certifying homes, offering technical assistance. You know, fortunately, I work for an organization that understands the importance of this. So I'm leaving here today to go to Atlanta to talk at an RX summit tomorrow to a bunch of physicians about this same issue. But also the certification process is implemented by the states to offer the support at the state level. I'm not going to read through all this, but we have model state laws. We do advocacy work. So you can go on the NAR website at naronline.org. Look at if your state legislators or your state agencies are looking for legislation to put in place that would actually allow friendly activity around recovery housing. There's opportunities to do that through this model state law that we worked on last year. We also, with NATCOM, the National Council for mental health, behavioral health, worked on a housing policy guide. This was stakeholders from both the behavioral health world and the recovery house world with strategies, tools, policy language. So these are just resources that I want to point out to you. But it's about protecting recovery housing and the rights of recovery housing. That specialized group that I'm talking about, this group, substance use disorder, is protected by the FDA. I'm sorry, the ADA, not the FDA. But ADA and Housing First. This is what our network looks like today. So we have 4,500 residents that operate with the NAR standards and about 30,000 residents total. That's significant. You know, we're by far the largest reach of any organization nationally. However, it's such a small percentage of those that need this problem to be supported. So national best practice, standard code of ethics, the formation of the NH cores and expansion of those groups, technical assistance to state and federal agencies. We do a lot of training with federal organizations and state organizations, policy formation and development I've talked about, and we do a lot of work on the Hill at the state level as well as at the federal level. One of the things that allowed us to be successful in Indiana is I work with legislators that basically said, if you're going to receive state funding, you have to be certified to a national standard such as NAR. And that's fair, right? I mean, if you're going to supply funding and support, you want to know that an organization is operating with certain levels of quality and, consistency. And the other thing, I guess I'll point this out again, is this is non-prescriptive. So when somebody, like my house happens to be Joint Commission certified as well, because we're now a subsidiary. The recovery house I operate, we're 62 years old. So it's a nonprofit that's been in business for a very long time. And we are a subsidiary now of another nonprofit. So we are Joint Commission. We're probably the only recovery house in the country that's Joint Commission. But the NAR standard, what I love about the NAR standards, it doesn't tell you what you have to be relative to your pathway to recovery, but it's going to ensure that what you say you are, you are. So if you're a faith-based house, well, what's the programming look like? If you're a 12-step house, what does that programming look like? Our favorite people, NH Core, right? You don't have any other context or anything to compare it to, but I can tell you that you have an amazing group of people here operating as your NAR state affiliate with NH Core. I attended the board meeting yesterday. It's a remarkable group of people, huge heart, a lot of talent. Their responsibility, provide certification to the residences per the NAR standards. And you can see the NAR standards. You can go online and take a look at those standards. And what they've done here today, participating and bringing together stakeholders across the community that have to be aligned, have to be speaking the same language, and at least understand where the areas of concern are if you want to make any progress serving this group of people, right? Technical assistance for any providers and new entrants. This is an important piece. If somebody is having a problem in a recovery house, there's a place for them to go with a grievance so that they can get resolutions of any complaints. Now that takes a lot of discernment and maturity for the state affiliate, not to just be the place where people are whining, right? So there's a lot of work that's done around there or done around that topic, but it's important for somebody coming into an environment where they're already intimidated to say, hey, there's a place that I can go if there's a concern that I'm not safe here. Provide learning opportunities, train operators of recovery houses, process improvement, collect data. There is a lot of work right now being done around recovery capital. SAMHSA published about 3 or 4 years ago, a paper that basically said recovery housing is evidence-based. For a long, long time, and it's been around since the 1800s, people thought it's just the wild, wild west. It was difficult to capture the data because it was, initially supportive and was, the participants belonged to these anonymous groups. So by the nature of the anonymous groups, there's anonymous activity. So putting systems in place together. And the thing that I'll tell you is, so I have a 62-year-old organization. It was considered the premier organization. Prior to our NAR certification, we had 28% success rates for people entering our program, completing it. Today, we have 60. Now, that's not tremendous if we're looking at a higher education and institution, a graduation rate, but for a chronic, relapsing, life-threatening disease, that is huge. The national statistics for just treatment alone, single digits. New developments. There's national drug control strategy working with the White House, the ONDC people, and Congress. Unfortunately, they created a new Office of Recovery at SAMHSA. Unfortunately, this 1.8% increase did not go through. However, there still is support for additional funding. So it was great to hear some of the funding opportunities here. we were able to be instrumental in getting a piece of legislation passed called the Excellence in Recovery Housing Act. So there's an interagency working group now at the national level, working with Congress and policymakers and funders to try to push money to the state level and hope that the state authorities will identify money and earmark it for recovery housing, right? For a very long time, because I spent my time going out and trying to ask for donations so I could pay for peanut butter and jelly. You know, I'd much rather be paying for improving programming and increasing, you know, our medication-assisted treatment practices, building capacity. And then the last thing is myself, and I think there's 4 other members of NAR, have been working with ASAM, the Addiction Society of American Medication. I'm sorry, American Society of Addiction Medicine, on a new chapter being published around recovery support services that includes a big component of recovery housing. And what this really means is that those clinicians that are writing treatment plans and bundling together services for people are now looking at where does recovery housing fit along with this clinical component so that there aren't all these separated pieces. You think about a consumer as a healthcare consumer, how difficult it is for you at times to go get the care you need for your primary care. Imagine for a person in an addiction to go get all the pieces. They're not savvy healthcare consumers. You know, they're in this traumatic state. So to be able to bring together, you know, a way for treatment providers and clinicians to bundle these services and say, here's what's needed, and then funders, insurance carriers to pay for some of that is unprecedented. So that will be published later this year. When a couple minutes over, I apologize. It is truly an honor to be with you here today. Thank you for your time, and I hope you have a great session.
Thank you, Darrell. Okay, so now we are going to turn to our interview portion of our program. And it's my pleasure now to introduce someone who probably doesn't need much introduction to many of you. It's Laura Knoy, one of New Hampshire's most well-known journalists. As many of you know, she was the founding host of New Hampshire Public Radio's The Exchange, which for 25 years was the state's most widely recognized and respected radio program. In 2021, Laura stepped down from the host chair to pursue other interests, including writing fiction, which is really cool. Her skills in interviewing, moderating, and public speaking are frequently called upon, by our center included. Laura recently joined the Rudman Center at UNH Franklin Pierce School of Law as its Director of Community Engagement. But she's also, and you probably don't know this, but a fitness instructor and a lifeguard at her local YMCA and host of the podcast Read Local NH. So please join me in welcoming Laura Knoy up to the stage.
Thank you, Max. Hi, everybody. It's great to see such a full room. Wow, this is wonderful. So we're going to conduct just a short series of interviews with 4 people, all of whom have deep experience with this issue of recovery housing. Then we'll take a quick break. We'll do our roundtable discussions, and then we'll have our panel discussion in the afternoon. And it is just great to be back with the Center on Ethics in Society again. I just adore working with Max and Hannah, so I cannot say no to them. It's wonderful to be here with all of you today. So let's get started right away. Our first interviewee, excuse me, is Kim Bock. She's Executive Director of the New Hampshire Coalition of Recovery Residences, which you just heard from Darrell. That's the state affiliate of the National Alliance of Recovery Residences, which certifies recovery homes in our state according to the national standard. And Kim, it's great to see you again. Welcome.
Thank you.
So starting off, we just got that really interesting national picture from Darrell Mitchell surrounding recovery homes. What does recovery housing look like here in New Hampshire, Kim?
Well, we all know that there are problems with...
Oh, I apologize. That was my job.
So we all know that New Hampshire doesn't have enough housing for anybody. There's certainly not enough housing for people in recovery. We have a map on our website, and our website is nhcore.org. And you have information on your table. The map on the website would show you where the recovery houses that are certified are located. And basically, they're on the 93 corridor. And there's a couple additional over in the Dover, Rochester, Somersworth area, and there's a couple in Keene and one up there in Claremont. But beyond that, most of the state is empty. There's no recovery housing for women west of 93 for women. Women aren't going to go to Manchester or Nashua if they live in Lebanon because they can't leave their children.
That's a profound statement that I think you just said, that most of the state is empty. I mean, when you said that, I just thought, why is that, Kim?
It's hard to get accepted into different towns, I think. I think there's some barriers, there's some fears, and I'm hoping that's what we learn about a little bit today. Housing is expensive. And it's difficult to get it started, to get it kicked off. And I really don't know some of the other barriers, and that's what I'm hoping to learn. Right,
and that's why we're all here today. What does that mean for the people in those communities? As you said, a lot of them just can't pick up and move to Nashua.
It means they struggle for more years in addiction, in active addiction. It means the town has to deal with cycles through treatment and maybe has other supportive services, but it's kind of like going for knee replacement surgery. You would never do knee replacement surgery without physical therapy afterwards. It wouldn't work. And that's what treatment is like. Treatment is really great. It's that acute response. But if you don't have the therapy afterwards and recovery housing of some sort, or a really supportive personal house, you go back to your own home and recover if you have the right environment. But if you don't have the right environment, it's not going to work.
Right, and that actually leads into the question I was going to ask you anyway. So the role of a recovery house in recovery. So you said it's kind of like physical therapy when you have a physical injury.
It really is. It's teaching people how to live as a family again. It's teaching people that interpersonal relationships are sources of dopamine, quite honestly. When you talk to someone at the grocery store, you get a little tiny high out of that. When you can sit down and have a cup of tea with your housemate, you feel good. When you can reach out, and all people in recovery are taught that when they reach out to help the other people in their house, it improves their own recovery because they feel good. They're building what we call recovery capital. And that really is self-esteem.
Yeah, I think we can all relate to that after the pandemic, especially not just seeing close family and friends, but those little interactions, the woman you talk to in the locker room at the YMCA, it does count for a lot.
Even for me this morning, seeing someone here without a mask on, it was thrilling.
Yeah.
I've only seen her on Zoom or with a mask.
Right. So, I can completely relate to that. So talk a little bit more, please, Kim, about certification. What is the certification process really all about? I mean, Darrell gave us a picture, but I'd like to hear about it from you here in New Hampshire.
So it's a pretty involved process that we go through. We are looking to make sure that people meet the national minimum standard. We go through their policies, their procedures. We look to see what their vision is and make sure that aligns with our national standards. If it doesn't align, then we can't certify. We also do a walkthrough of the house, and we measure bedrooms, and we count bathrooms, and we test smoke detectors. We do a scripted interview with all of the residents to make sure that all those written policies that we've found are adequate and appropriate, that they're living out. So people in recovery houses, they have curfews, they have chores, they have smoking policies. They can't smoke in the house. They have to be outside to do that. They need to work. And I think that's probably one of the real important things for towns to know, is that people in recovery houses are required to work. That's part of gaining self-esteem. That's part of recovery capital again. So it does make a great source of employees for a town.
Wow. And I know we're going to have someone later today who has done so much for employing people in recovery, right, who are living in recovery houses. So there's a physical infrastructure, but there's also a social infrastructure that you're looking at, Kim.
There is a social infrastructure, and that's that family structure again. It's knowing that if someone, typically people share a room, and they do that because isolation, for all of us, we found in COVID, as you said, isolation can bring on depression, but that can also bring on addiction again. So sharing a room means that someone else in that room will be there at 2 o'clock in the morning when all a resident wants to do is go out and use because they have so much pain. And that other person, that other roommate, is sitting up with them and saying, you only got 20 minutes to get through this. 20 minutes and you'll be okay. And that's the support that they give each other and they learn to give each other.
So when a person wants to open up a recovery home, they go to you for certification. They also need approval from the city or town. And I know we have a lot of people on all our various panels today who are going to talk about it from a planning perspective, a building code perspective, a fire perspective. But what are some of the biases and fears that homes might encounter when they enter a community or when they want to enter a community?
I think sometimes, and again, as we've talked about, I really want to hear from everybody here, what are the barriers, what are the concerns? Because I make assumptions. Sometimes what I've heard is that people are afraid there's active drug use happening in the house. There isn't. If someone does go back to active use, they are asked to leave immediately and they're given assistance in leaving. So they may be helped back to detox or to treatment or to a shelter or to a more appropriate place to be. Clearly, it's still up to that individual what they do.
How do you counter those perceptions?
Education. Education is the key. Talking. That's the reason why we're here today and why we have a really interesting group of people together today, I think.
Again, I'm so struck by what you said that much of the state is empty. You've kind of addressed this already, Kim, but just to wrap it up, what's it going to take to fill those empty spaces in our state?
Finding real estate.
Yeah.
That's probably the biggest barrier for everything, right? I think there's plenty of funding that's coming federally and from the state level. I think there's plenty of support. It's finding support within the towns. It's finding the place in your community to be able to take care of everybody and make the entire community grow in a more healthy way.
Okay, Kim, it's great to talk to you. Thank you so much.
Thank you very much.
Really appreciate it. That's Kim Bock. She's Executive Director of the New Hampshire Coalition of Recovery Residences. Well, moving right along, we have Shawn Toomey with us. He's the State Fire Marshal for New Hampshire. Yes, Kim, thank you. And Marshal Toomey, nice to meet you. Nice to talk to you. And thank you very much for being here.
Good morning. Thank
really
you.
Appreciate it. What is the State Fire Marshal's primary interest in recovery homes?
So I think our primary mission is to make sure people are safe in recovery homes. I think we put, as code officials, like to put people in boxes or in chapters, as I like to say, and recovery homes didn't fit neatly in a chapter. And our interest in, I think, is figuring out how to nicely put someone in the chapter in our code world and make sure that anyone really, frankly, in that matter is safe wherever they're living and where we're working.
Yeah, so that's really interesting. And we talked about that on the phone. So how did you in your office have to change the chapters, so to speak, to recognize the reality and the need for recovery homes?
Sure. So from the fire code perspective, and Bill McKinney will be up here a little bit later, I think, speak to the building code. I'm looking at him but in the fire code, we really look at 1 and 2 family dwellings, or the next jump that was logical to us was a rooming house. And when we think about rooming houses, a lot of things we've already heard this morning from Darrell and for Kim is the family and the social like atmosphere and the accountabilities weren't there a lot in the rooming houses. It literally was someone renting a room and staying in the room, and there was you don't know what's going on, who's living sometimes in the bed next to you. And that, I think, for me, especially in many of us that were involved in this early in the last 5 years or so in the code world on the fire side, is that a recovery house is very different. So, and we kept kind of drawing back to 1 and 2 family, but we're hanging up on what we were traditionally known as family of a husband and wife and a couple of kids and a dog or a cat, and that really wasn't quite what recovery was. And that's, I think, where our struggle was. We had to get over some of those hurdles.
So how did you get over that hurdle? How do you sort of define a family residence today for the purposes of the fire code and making you feel good about that? So
we did a couple things. One of them, I think, is really touring many homes and seeing the difference between a well-run home and a home that didn't follow the NAR or the New Hampshire Court standards. And when we began to see that the homes that are run well were family-like, you could go into a house and talk to someone that even a 2 or 3 family home. I think the one that hit me the most is one in Manchester, a 3-decker. You could talk to someone on the 1st floor and they would know where the person is on the 3rd floor, where they were working, what their name was, when they were going to be home, and things like that. And that's not a rooming house. And so what we wanted to do was balance what a 1 and 2 family home looked like, and kind of put it into recovery home into a 1 and 2 family. So we through education, I think, talking to a lot of people, we also worked in 2021 to get some changes to the statute to have the ability for the fire marshal's office to issue a variance. And I know Kim will kind of not totally comfortable with that concept because it's still a discriminatory nature, we believe, to that. But the real reason we did that was to try to do for consistency, that it would come to my office, we would work with the local fire officials and really try to apply the standards really at our level and help the local communities apply it consistent. And our concern was if that didn't happen at our level, where it would be all over the place. And that's really where it comes down to. So the statute is, I think, is where we came up with and to kind of guide us.
So is there a statewide policy on safety codes and recovery homes, or is it determined town by town?
So we have the state fire code in place, and then towns are allowed to be more restrictive if they want through their own local governing boards. But then, as I mentioned, we have RSA 153.10D specific to the variance process for recovery homes, and that would come to our office, and it would kind of give us a little bit extra guidelines for a recovery home.
Okay, so towns are allowed to be more restrictive.
Yes, they are.
Do you sometimes get complaints in your office from,
Never.
you know, people say, you know, we want to open up a recovery home, but the town is being too tough. Do you hear that?
We do. We hear it from recovery homes. We hear it from driveway access. We hear it from all kinds of different things. But, you know, I think that the key for if they're going to be more restrictive, it has to follow a local legislative process. Like it has to be approved by the Board of Selectmen or through the town meetings or whatever the process is locally. It can't just be at the whim of a local fire chief or one of us as an inspector, or, you know, you can't make it up. So there's really should be some thought and approval process. And then now it's reviewed by our office and the building code review board to make sure there's not conflicts, to help with some of that. So I hope that some of that's minimized. And then I know Bill's pushed it through the Building Officials Association. We continue to share it with the Fire Prevention Society and the Fire Chiefs Association. Is if you end up in a situation where you have a recovery house in your community, please reach out. There's people that have worked through this for the last at least 5 years that I can account for. And we're here to help and try to make it a safe environment.
Yeah, and we do have an attorney joining us in a moment. We have building code officials. We have all sorts of people who are going to touch on these various aspects. But just to wrap up with you, what policy changes would you like to see, either at the state level or the local level, regarding recovery homes?
So I'm not sure it's necessarily a policy change. And I think that the biggest concern I have right now is that I think that we have a lot of homes still operating sort of underground. They haven't come forward. I was talking to Kim when we first started, and there's almost 90 homes certified in New Hampshire right now. And I know 90 homes haven't come to the State Fire Marshal's office. So, you know, we really want the homes to be safe. And so I think if, you know, I don't know how we're supposed to get a variance. So I guess that's our policy. We have the policy. It's just, I don't want to heavy enforce it, but we really want to encourage homes to come forward and work with us and try to really make sure people are safe that are living in their homes. You know, we educate people, every one of us in our own homes, that you have working smoke alarms, because that's where we have our fatal fires and things like that. It's really no different that any place someone's sleeping, we want you to be safe.
So do you think that sometimes people aren't coming forward saying, I have a recovery home, because they're afraid the local or the state fire officials will come down too heavy on them? I'm just wondering about that disconnect that you mentioned, you know, the 90 homes and they haven't come forward to you.
I would definitely say that from my perspective, I think there's a concern about all of us, is whether it's planning, zoning, building, or fire. Like one of the four of us, I feel like, is going to put some hurdle up. And I'm sure that I see nods for some of the operators that I know around. That's a concern. And I think that we got to figure out, and that's why we're here. That's why I said, hey, Max, I need your help. So
yeah.
Yeah, I think if we continue to educate all of us and figure out how to meet the legal requirements and get through that, it'll be helpful.
Well, and we'll have those roundtable discussions later. So as you said, more conversation. Thank you for the perfect segue into our next guest, who's a lawyer. And Marshal Toomey, it was really good to have you. Thank you for being with us today. Yeah, thank you so much. That's Shawn Toomey, again, New Hampshire State Fire Marshal. And very instrumental in pulling us all together today. So that's wonderful. I do want to introduce our next guest, Craig Donais. He's an attorney with Wadleigh, Starr, and Peters. Craig works with clients in this area of recovery housing. And Craig, it's really good to see you, not on Zoom, as someone said earlier. So thank you for being here. How did you get involved in representing clients who work in this field, Craig? And what types of clients do you work with?
So I started.
Oh, and I apologize.
So I started to get involved in this space back about 2010, 2011, when I was asked to work as a volunteer board member of a community-based not-for-profit that provided recovery housing for about 30 men here in the city. And that board was predominantly, I guess, program-driven. And they had a couple of staff, but they needed to kind of move things along a little bit and put a little bit more structure. And then with that, I started working with them on some of the I'll call them unenrollments, where folks were no longer going to be participating in the program because they were not following the house rules and dealing with some of those issues. And then from there, I started working with other clients kind of on their, I guess, business related issues, and then unenrollments from the program. And since then, I've expanded out and have probably a dozen or so clients that work in the space, or a dozen or so facilities, and they range from some treatment facilities to recovery housing.
Wow. Well, it's really great to have you here because there are a lot of legal issues. And what are some of the key national laws that come into play, Craig, with recovery housing? Darrell mentioned the Fair Housing Act. He mentioned the Americans with Disabilities Act, but I'd love to hear that from you as well.
Yeah, so those are the two main ones. The Fair Housing Act, which dates back to the 1960s, and there have been amendments in the 80s and still constant changes on that. And then the Americans with Disabilities Act in 1990. And I guess the key takeaways from those is that under the Fair Housing Act, family is not necessarily, as Shawn was talking about during his interview, just a mom, dad, 2 kids, a dog, and a cat. The definition is more expansive, and it can include unrelated persons. And then when you start dealing with disability, which has also been put into the Fair Housing Act, it requires that you have some level of reasonable accommodation, both under ADA as well as fair housing. And so under the Fair Housing Act, that reasonable accommodation also applies to some zoning restrictions and things like that, that it's more than just putting a ramp in to have fair housing and providing that accommodation. It may be that variances might need to be looked at in a different perspective and dealing with the community that we're working with.
So those are the big national laws, the Americans with Disabilities Act, the Fair Housing Act. What about local ordinances? I'm guessing that's often where the rubber hits the road. Craig, how much do these play a role in whether or not recovery housing is created?
I think it plays a big role. As Shawn was mentioning, they try to put it in chapters and check boxes and things like that. And a lot of times the initial reaction is, I want to have recovery housing. Well, that's a boarding house. Is it really a boarding house or is it not? And how do you convince municipalities that it is not a boarding house? You run into issues under state law of they're living in the facility, the recovery housing. Is it their housing and falls under landlord-tenant law? Is it not housing? So how does that all fit together? And if someone needs to be discharged or is no longer following the rules of the program, it's problematic for them to stay because the other participants in the program have that expectation that everyone's going to be living that abstinent, sober life with the structure and supporting the community. And when one person doesn't, that person may be losing their housing because they're no longer in the program. But if they stay, it can bring everybody else down.
What types of cases either have you worked on yourself or do you watch in the region that kind of illustrate some of the legal struggles around this?
Okay, so I've been working with some clients on trying to work through some code related issues, and sometimes the trigger is there a regional impact off of the facility? I mean, certainly if you're in a larger municipality, there's less of a concern because there's the municipal infrastructure. But if you start putting a facility into a more rural community where they may have a very small police or fire, it's volunteer, they may be relying on mutual aid. That's been a concern that's been raised of what happens if we need extra services in the community. So we're working through those types of issues. We run into zoning issues and code issues about sprinklers and is it really a commercial use? Is it residential use? As Shawn mentioned, these things don't necessarily fit in a box. And so we look at ordinances that are written kind of with one perspective in mind. But then when you start looking at recovery housing where we don't necessarily use the traditional definition of family, and we look at what those accommodations are, you have to kind of look at some of those shades of gray and deal with that. I guess in terms of some cases, there was a jury verdict against the town of Cromwell, Connecticut. The town was actively opposed to and objecting to a sober living facility in their community. They were hit with a $5.2 million jury verdict out of the federal court in Connecticut. About 200,000 of that was in compensatory damages, 5 million in punitives.
Wow.
Back in February of this year, the town of Hinsdale, Illinois, settled a case with the U.S. Department of Justice, where they were using their zoning ordinances to try to keep recovery housing out of their community. They settled that one for $800,000. So there's the potential for some big money cases if municipalities are not responsive and looking at these issues. But that being said, there's also cases where programs will bring suit against the municipalities for code-related issues. There was a case out of Fort Lauderdale, Sailboat Bend Sober Living brought suit saying it's unfair that you're requiring us to comply with fire code issues. And they also said your cap of 3 unrelated persons is unreasonable. And the federal appeals court ultimately said that the city's ordinances were fine because the fire-related issues were a safety consideration and they were a broad general applicability. And in that case, the cap of 3 was reasonable because that was even higher than what would otherwise be allowed under the zoning ordinance. So 3 was not okay, was okay in that case, but there's other places where 3 is not okay.
Wow. So people who want to block recovery homes or set up recovery homes really need to dot all the I's and cross all the T's. Those lawsuits that cities faced for blocking recovery homes are significant. Why do you think, I was so struck by what Kim said, that much of New Hampshire is empty. Why do you think that's the case, Craig?
I think a lot of this ends up being, how do you find the support? And unless there's something that is local, people tend to live in their communities. People talk about where they're from and it's community-based, it's not state-based. And so the larger areas, I think, have a better structure, infrastructure, and resources to make that happen. And when you start to say, I want to put a sober living, recovery house in some community, people say, not in my backyard. But the reality is the people that are going to be participating in that program are in your backyard, and you just don't know it. And so we always also see the concern of, well, there's an incident, there's a relapse that occurred at this facility, and therefore it's a problem. But the reality is 95%, 99, 100% of the time, with those rare exceptions, things are going well. It's just when it goes bad that we hear about it. The reality is people are overdosing and there's problems that happen, maybe not at the facility, but next door in your backyard anyway.
Somewhere else in your town, you just don't know.
You just don't know it, right?
Yeah.
And I think by having these types of facilities, it solves both the substance abuse as well as the housing problems we have. And it really becomes a two-for solution, that housing and substance abuse are addressed in that community, in that program, and it provides that support. And when individuals get through that and they move out of the recovery housing, in a lot of ways, it helps to stabilize that community.
Wow. Well, Craig, so much on the legal front. We barely scratched the surface, but I really appreciate you being here today. Thank you very much. It's great. Again, that's Craig Donais. He's an attorney with Wadleigh, Starr, and Peters Law. Lots of legal issues to wade through. That was really interesting. Lastly, we're going to hear from a Granite Stater who has personal experience with recovery housing. Joining us now is Shawn Cannizzaro. Today, he and his girlfriend, Melissa O'Brien, run Hope to Freedom Recovery Homes in Claremont. Shawn lived in 2 different recovery homes in Littleton starting in 2019. And Shawn, it's great to see you.
Hi.
Yeah, and microphone. So we had an amazing conversation on the phone last week, Shawn, and I told Shawn to write a book about his experiences, so he's going to work on that. But just to summarize here for the group, after 30 years of drug addiction, almost 20 years of various periods of incarceration, you ended up on the doorstep of a recovery home in Littleton. You arrived after you had overdosed and almost died in Florida. And you told me on the phone, Shawn, Littleton saved me. And I was so struck by that. How did Littleton save you? Yeah, I meant to bring up some Kleenex. Okay, and bring the mic up to your mouth. Yeah.
Well, Darrell had mentioned it. It's about being grateful. That's why I always cry. I have so much to be grateful for, because I ended up in Littleton from a near fatal overdose. And it was the structure and the discipline of the program that I could relate to. I've been in and out of prison my whole life. I can do well in a structured environment, and that's why it's important to have safe, structured recovery houses. It's everything that I needed at the time was there in Littleton. And you'll hear from my old boss later on, a recovery-friendly workplace. I had 12-step meetings. I had therapy. I had support. I had a roommate because I was wanting to leave. Like Kim touched on, at 2 a.m. I was the only city kid up there. I was the only one who did almost 17 years. I was alone. I felt alone. I wanted to isolate and I wanted to leave or get high. And they wouldn't let me. They gave me hope.
They never gave up on you.
Yeah, they never gave up on me. I always say that they saw something in me that I didn't see in myself.
Yeah.
Because I'm deadbeat dad. I label myself junkie. I get that whole not in my backyard thing because I do that to myself sometimes. The disease of addiction does that to me. So I have to battle it. And I need help and support from other people, especially other people in recovery, to say, no, you are worth it. Let's get through this together.
So you told me that also that living at a recovery home isn't all sunshine and puppies and unicorns. Yeah. I mean, people are working through some tough stuff. Yeah. They sometimes don't act like perfect angels, yourself included. What was the approach at the recovery houses where you live, Shawn, where somebody messed up, either they abused substances again, they did something else that went against the house rules? What was the approach there? Because it's tough.
It was supportive. Well, like Kim said, when someone had a reoccurrence, as the word they use nowadays, or relapse, they were asked to leave, but it was the way that they were asked to leave. It was, can we help you get somewhere else? Can I bring you somewhere? What's the plan? If you just want to leave, here's some Narcan. And it was other people like myself. The owner is a guy who has done some prison time, who was in recovery, who does 12 steps and owns a recovery home. So he was able to identify certain things I was going through and zone in on those, because it's pretty much the same exact thing that he went through. So it was identifying what I was feeling and what I was going through and able to help and target that instead of just putting everybody in a box. Each person is different. You got me who's institutionalized, so I don't like the way someone looks at me. I think they want to fight. And you have someone who has never even saw a prison movie. So you got a whole bunch of different people in early recovery where you're dealing with, I haven't seen my kids in years. You're dealing with people that have lost their mother and they don't know how to they don't know how to deal with those feelings unless they use or unless they get high. So it's just emotions everywhere.
Yeah, so you're all in this house together. You're all trying to, like you said, you're going through some really tough stuff. How did the recovery houses you lived in sort of manage that? I mean, that's a very special skill.
It's each house eventually has a peer leader or an assistant peer leader. Some houses have just one, some houses have other ones. And they're basically trained from the owner and at that house, one of the regional managers. And these regional managers and the owner have done trainings and they're educated, so we're able to deal with it. Yeah. It's basically just having a conversation. How you feeling? What's going on? Be real with me. Tell me what's going on so we can help. Instead of just, all right, we don't like the way you're acting, get out.
Yeah, right. Well, one of the great things about your story, I mean, there's so many great things. I also encouraged Shawn to do a TED Talk. Yeah. I told him to write a book. I told him to do a TED Talk because his story is amazing. And I feel sort of badly glossing over it here. But one of the many great things about it is you and your girlfriend, Melissa O'Brien, are now running a recovery home in Claremont. You got plans to open 2 more. Given your own personal experience, Shawn, what's your philosophy now as someone who runs a recovery house?
Well, when I was in the recovery house, I learned what I would do and what I wouldn't do, because no one's perfect. It's people make mistakes. And me as the manager of that recovery house, I was too hard. That ex-convict prison mentality works with me, but it doesn't work with everyone. That structure and discipline works with me, but not everyone. And I was too hard on some people and they left. You know what I said to myself, when I own my own, I'm never doing that. You know, and I don't know where these guys are. You know, I don't know where they are. So I learned what to do, what not to do. You know, and when I have questions, I ask other guys in this room. Literally, there's 3 or 4 guys that I call up all the time. Hey, this is going on. I need your help. This is going on. Other recovery homeowners. There's powerful people in this room, but in my mind, the most powerful people in the room are my girlfriend, the other recovery homeowners, people that work in recovery, that are in recovery because they get it. You know, I can call the mayor of Claremont anytime, but he's not going to get why someone wants to leave my house.
That's a lot of hard self-awareness to say, okay, this is how I would deal with the situation. I spent 17 years in prison. This is sort of, I've got that hard-nosed approach. It must have taken a lot for you to say, okay, this is how I would do it. It doesn't work with everybody.
Yeah, because I want to throw everybody out.
Yeah.
I'm serious. You know, my brain is wired differently. Thank God for Melissa, because it's the balance.
Right.
You know, my first thought is always wrong. Yeah, serious. And it's, you know, like Kim, we call up Kim all the time. Hey, what about this? What about this? I don't know. What about this?
Right. It takes a village.
It's that connection to people. It does. It takes a village.
So you're working on making Claremont a recovery-friendly city, which is awesome because it's so badly needed, especially off of that I-93 corridor, as Kim said. And it's all because you told me someone said yes. So someone said yes to your friend Keith in Littleton, someone said yes to your friend Keith in Littleton, so he could start that recovery home. And Keith said yes to you. And now you want Claremont to say yes to becoming a recovery-friendly city. So 2 more questions. At the community level, what are you doing, Shawn, to encourage Claremont? And I don't know, is there anybody from Claremont here today? Okay. To say yes to more recovery housing.
Melissa and I are actually going in front of the city council today to start that conversation with the city council.
Wow.
The mayor's on board, but it's politics. You got to do it the right way. And we're in talks with the county manager, Derek, to have Sullivan County become a recovery-friendly county.
Oh, wow.
So yeah, and it's important because we need people to say yes. Take some risk, man. You know, take some risk, because if Keith, a lot of other people I grew up with called Keith and said, hey, I want to get clean. Help me out. Let me come up. You know, I'll pay this. And he said no. And he took some risk with me, and I was a problem. You know, I'm still institutionalized. Like, I was a nutcase. And he took some risk and he said yes. So it's important that we take risk, and we just, not everyone's going to succeed. You know, it's important. We have so much help out there and so many resources in Claremont, the city manager, the mayor, the previous mayor, all of those, you know, powerful people, as I call them. It's all great, but we need them to say yes. We need the support and help of the city, because it knocks down a little bit of that, not in my backyard. You know, they can help us spread the word. Like, we're not all bad people. We're not going to break into your house. You know, recovery housing is not going to attract active users. It's going to keep them away because it's the solution.
Yeah, like some of the statistics Darrell gave this morning were so powerful about the role of recovery housing in recovery. So at the individual level, Shawn, what does it take for somebody who's struggled with addiction, as you did, to say yes to even entering a recovery home, to take that step?
For me to say yes?
For anybody who's struggling with addiction, to say, yes, I'm going to do this.
I'm going to desperation.
Yeah.
It's, with me, it was, I didn't have anything or anyone left. Like, I almost died. You know, I ruined my life. Rock bottom, as some people call it. You know, I was done. I had no other choice. I literally had no other choice. You know, and that's where most addicts and alcoholics end up. No other choice but to get clean, man. This is all we have to do. This is it. That's all we have left. So it's that gift of desperation.
Okay, so again, I feel badly cutting off here. Wait for the TED Talk, wait for the book.
Yeah.
We'll come back. Shawn's going to be here all day, and it's great that you're going to the city council tonight too. For now, Shawn, though, thank you so much. Really appreciate it. Wow. That's Shawn Cannizzaro. He and his girlfriend, Melissa O'Brien, run Hope to Freedom Recovery Homes in Claremont. They've got one. They're going to open 2 more. And as I said, he lived in 2 different recovery homes in Littleton starting in 2019. And we're going to hear from someone in Littleton later today. I would now like to invite Center for Ethics and Society Director Max Latona back up to move us into our next segment. So Max, back to you.